Hi, my name is Luc J. Hébert. I'm the Director of Research Partnerships and Chair of the Scientific Committee at the CPCOE. The Chronic Pain Center of Excellence, the CPCOE for Canadian Veterans, was established to conduct research and help improve the well-being of Canadian Armed Forces veterans and their families suffering from chronic pain. And among the tools developed by the CPCOE to support research is our CBI program, kind of a grant program for graduate students who wish to conduct research on chronic pain in Canadian veterans. As part of Veterans Affairs Canada Life After Service survey, a survey conducted periodically, including in 2016 and most recently in 2019, we have observed that veterans are twice as likely to suffer from chronic pain as the Canadian population. And this pain prevalence increased by 10% in a most recent survey conducted in 2019. So following this observation, it was clear that there was an urgent need to address that issue that was quite concerning. So the CPCOE was founded by Veteran Affairs Canada, by VAC, a nonprofit organization established on April 1st, 2020 by McMaster University and the Hamilton Health Sciences Corporation. CPCOE was created to support and develop research on a very specific population, that of CAF and their families living with chronic pain, all with the ultimate goal of improving well-being and quality of life of this population. And while the mandate of CPCOE is not to provide care and services, it's extremely important to us that the results of funded research and the resulting recommendation be shared with a national network of interdisciplinary pain management centers, clinics that provide care and services to veterans, and key decision makers and players in our healthcare system. When we look at the statistics for each province in Canada, we see that the number of veterans is somewhat proportional to the population size of each province, with greater numbers in Quebec and Ontario. Oh, sorry for the slide. And when we take a closer look at the distribution of veterans by age, we see a change that has occurred over the past few decades, and it's not all that surprising given the combat missions and deployments in which Canada has been involved in the past 20 years. We can see that about a quarter of our Canadian veterans are over 75 or even 85, but almost half are between 25 and 60 years of age, which is relatively young. And these people are young and may still be very active in society, but unfortunately, many have suffered serious physical and mental injuries because of what they had to accomplish during the missions in which they served our country. So it is important that our research priorities at the CPCOE are aligned with their needs and those of their families, which is why at the core of all CPCOE activities is the principle of veteran engagement. Consultation and engagement with veterans, which includes an advisory council for veterans to advise on research priorities, began prior to establishing the organization and continues as a lasting priority. So this ongoing engagement helps the CPCOE to develop a deeper and more thorough understanding of the day-to-day challenges veterans and their families face because of their experience with chronic pain. So that understanding is used to shape research to ensure that it will have a genuine and practical positive impact on the well-being of veterans in pain. So to help facilitate research with a focus on veterans and including veterans within the research, CPCOE has developed a veteran engagement toolkit. More information can be found on CPCOE's website. If possible, CPCOE encourages all projects to incorporate veterans. As you can see on this slide, this approach has been a great success because since 2020, more than 75 projects have been founded by the Center of Excellence in a wide variety of fields, all of which address some aspect of chronic pain among Canadian veterans. And these projects cover a wide range of topics, including understanding the needs expressed by veterans, evaluating interventions, care provided to veterans, and particularly interdisciplinary care, self-management programs, the use of cannabis and ketamine, and even media coverage of veterans. And as seen on this slide, funding requests for these CPCOE subsidized projects came from 8 provinces, 30 different institutions, and 2 countries. The CPCOE has awarded over $8 million in research funding since 2020. And the amount of almost $500,000 shown on this screen is a good example of the CPCOE's financial efforts to support master's and doctoral students whose projects are related to our research priorities. And it is actually the equivalent of a scholarship called the Capacity Building Initiatives, or CBI. CBIs are important because they support research in veterans' chronic pain. The CBI's program was created with the goal of increasing the number of researchers whose research is relevant to veterans living with chronic pain. This program encourages and supports new research to improve the well-being of veterans living with chronic pain. Each year, the CPCOE offers one master's CBI in the amount of $27,000 per year for 2 years, and 2 doctoral CBI in the amount of $40,000 per year for 3 years. We also offer another master's CBI called François Dupéry Master's CBI in order to honor the memory of the founding member of the Advisory Council for Veterans, François Dupéry, who passed away on 20 January 2021. François was an inspiration as a veteran and as a human being. To preserve his legacy as an advocate for resiliency within the veterans community, CPCOE established a specific CBI in his honor to fund the work of a new Francophone master's student on a yearly basis. So who can apply? To be eligible, you must be registered in a master's or doctoral program at a recognized Canadian university, propose supervised research in chronic pain with a focus on Canadian Armed Forces veterans that is relevant to the CPCOE vision and mission, and demonstrate high academic achievement. The applicants to the François Dupéry Master's CBI must be a Francophone Canadian citizen or a Francophone permanent resident of Canada. And this person must also be registered in a master's program at a recognized Canadian French language university. To apply, simply use the link that appears on the screen, and you will find all the information you need about the documents to submit. Now, I would like to invite one of our CBI recipients to share her experience with you, Dr. Sarah DeGrace. Sarah?
Thank you so much, Luke. So as Luke mentioned, I'm Sarah. I'm currently a postdoctoral fellow at Dalhousie University, which also involves a partial internship with the Chronic Pain Center of Excellence for Canadian Veterans. And I just wanted to take a few minutes to share what the CPCOE has sort of meant for my own career. And I think that's largely because of the early support I received from the CBI program. So I was a CBI recipient during my master's degree in 2021. And with that funding, I looked at a pilot study examining the interactive effects of chronic pain and post-traumatic stress on adverse cannabis use outcomes in veterans. And at this point, chronic pain wasn't a central part of my own research, but my work has certainly transitioned to include it because of the CBI funding I received. It really opened up a whole new world of research questions for me and helped see how my existing expertise could be translated into a pain-related research and work that really matters in people's lives. So, of course, the CPCOE did offer financial support, which was really incredible, but they also connected me to a really great network. I was able to present my work at the CPCOE's annual stakeholders conference on veterans chronic pain. And I spoke there with many clinicians, researchers, and veterans with lived experience. And these were all incredible opportunities for networking, as well as really coming to understand why including individuals with lived experience in research is so crucial. So I gained mentorship, I gained, a financial aid and a lot of interdisciplinary exposure. And these experiences really directly shaped the collaborations that I now seek out as a researcher and postdoctoral fellow. I'm continuing that work now at the intersection of post-traumatic stress, substance use, and chronic pain. And I ended up back with the CPCOE because of those connections I made back in 2021. I don't know that I would be on this trajectory without the initial investment from the CPCOE at my training level and the master's level. So I'd say if there's one message to leave you with, it's that the CBI funding can really be a launching pad into a new expanded research identity and doors you didn't even know existed that really connect you to this community that values impact and collaboration and real world relevance of our research.
Wow. Thank you, Sarah, for this sincere and compelling testimonial. It is greatly appreciated, and we're so lucky and fortunate to have you with us. Thank you. All the details of our contest for CBI are available at the link displayed on the screen. And you may have the type of questions we see on the screen right now. Do I already need to be doing research on veterans to apply? No, you do not need to already be doing research on veterans to apply. As long as your project has a focus on Canadian veterans, CPCOE can help you learn more about the population. I don't really know what a Canadian veteran is. Can I still apply for funding? Of course you can. You can still apply for funding as long as your research is directly applicable to Canadian veterans. I am already in year 2 of my program. Can I still apply? Yes, you can apply. At any point during your research, the length of the CBI will be adjusted. For example, if you are in a year 2 of 2 for a master's and your research was accepted for a CBI, you will receive 1 year of funding. When are the CBIs open? CBIs are open annually during the winter. Subscribe to CPCOE mailing lists and social media to be notified as soon as opportunities open. And for any additional questions, you can contact us using the contact details shown on the screen.